A recent study published in the British medical journal BMJ seeks to further expand what's known about kids and COVID-19. It looked at children with coronavirus in hospitals around the United Kingdom and found that severe illness was rare and that death was exceptionally rare. Joining me now to talk about it is Dr. Olivia Swann. She's the lead author on that study. She is also a clinical lecturer in Paediatric Infectious Diseases at the University of Edinburgh. Dr. Swann, hello. Thanks for coming on.
Good morning. Thank you for inviting me.
That study is encouraging news, especially at a time when we just heard more than 70,000 new cases in children have been reported across the U.S. since early August. Can you tell us more about your findings regarding children and the effects of COVID on them?
Absolutely. So you're absolutely right. This was a large study across the UK, across England, Scotland and Wales, and we looked at admissions with COVID-19 in children under 19 years old in 138 hospitals. And we found that children made up only a tiny proportion, so less than 1% of all admissions across all age groups to hospital with COVID. And that, as you said, that death was exceptionally rare amongst children. So less than 1% of this 1% of children died in hospital with COVID. And that every death of a child with COVID is a tragedy. I'm not trying to downplay that at all. But what I want to say is that it really was staggeringly low in comparison to the all age group death rate of 27% in hospital. So 1% versus 27%.
And are the odds of severe disease and death low in children across all ethnicities?
So that's a really good question. So one of the things that we looked at in our study was admissions to intensive care or critical care units. And we found that there were a number of factors that were associated with increased risk of a child needing extra care. And one of those factors, as you say, was ethnicity. So children of Black ethnicity were 3 times higher chance of needing critical care. But what I want to really stress is that the chance of children needing the extra help was really very tiny. So when we're talking about an increased risk of 3 times, if we think of it as the volume control on a radio, if you're going from 0 to 100, these children are not going from 30 to 90, they're going from 1 to 3. So the absolute risk is tiny, but yes, the increased chance in our study appeared to be related to ethnicity.
Well, what are the underlying causes for children who do become severely ill from COVID, even though the numbers are low? But what are the causes?
So the other factors that we found in our study were neonates, so babies under 1 month of age, children 10 to 14 years, and these seem to be the group that are associated with the inflammatory syndrome, as well as children who were obese, those born prematurely, and those with underlying cardiac and respiratory disease.
Well, another U.S. report, Doctor, a joint report from the American Academy of Pediatrics and the Children's Hospital Association showed child cases increased by 21% between August 6th and August 20th. What is the likelihood that that could be related to young people returning to school?
So our study didn't look at transmission dynamics, and we are really just reporting children who've already been hospitalized. I think an important thing is to say that although children do seem to be at lower risk of severe disease, that it's not no risk, and that there really shouldn't be complacency about the things that we know work. So social distancing and hand washing, for example. And I think that those messages need to still be driven home at the same time as being reassured by the findings of this study.
Well, we know the problem that the United States is having on college campuses right now, but these are young adults who, for the most part, aren't social distancing. They're going to parties, not wearing masks. That's different from younger children in school, isn't it? Talk about how susceptible young children are to getting COVID in the first place. And what would you tell a parent who is contemplating sending a child back into the classroom right now?
So you're right. So our study only looked at children and young people up to the age of 19. So we didn't look at children of university age young people of university age in our study. But I think what I would like to say is that I have children myself. I'm a parent. So I'm a parent, I'm a children's doctor, and I'm a scientist. And with all of those different hats on, I find the numbers of this study and our findings very reassuring. And I hope that they serve to help reassure parents in being comfortable sending their children back to school.
I'm sure it will, because as you know, everyone wants their kids back in school. It's
Sure.
good for them, and it's good for the parents who've been going kind of nuts the past few months, but they want to
I
be
can
able to
attest
do
to
it. I'm sure you can want to be able to do it safely. So thank you for your research and for sharing it with us, Dr. Olivia Swann. Thank you.
Thank you.